The dialysis access, as we explained before, could be either fistula, graft, catheter, whether it's hemodialysis catheter or peritoneal dialysis catheter. All of these accesses are unnatural. The body does not want to have their artery attached to a vein, does not want to have an external foreign body introduced into the vein or into the peritoneal cavity. And so because everything is unnatural, the body, in a way, tries to fight what's going on and what we need for the patient's lifeline for them to receive dialysis. And so therefore, the body will react with either scar tissue or narrowing, if it gets irritated, inflammation, and this will all cause dysfunction for the access. Every other day at dialysis, the patient presents to the dialysis unit and their access, whether it's a fistula or a graft, will be cannulated, will have a needle stuck into their fistula or graft, in a way damaging the fistula and the graft. And so even if everything was to go well and the veins and arteries are all open, there is still some damage from cannulation that can occur for each patient. And so we need to manage and maintain this access. And what we do is to make sure that the flow from the artery, from the arterial tree, into the fistula, across the connection, which is the anastomosis, the connection between the artery and the vein, to make sure that that pathway and that conduit, that circuit, is all open and running well. In order for a patient to receive adequate dialysis, you need a certain amount of blood flow. You need the fistula or graft to be a certain size so that they could put the needle into. And you also need the pathway from the fistula back to the heart to be wide open to allow for easy flow back to the heart and decreased pressure within the system. In order to ensure adequate flow through this system, one needs to maintain this access.